this very novel topic. I request our President, Dr. Shibal Gulati ma'am, to introduce the speaker, the topic for today, and the experts for today's session. Over to you.
Yeah, thank you, Mahesh. Good morning, good afternoon, and good evening to all. Before I introduce the speaker and and the session, just wanted to say that we have a workshop on holistic management of autism, current updates, with the coming on 21st and 22nd of September. And because of overwhelming registration, we are planned to make it hybrid, so anybody can log and apply for the same. And after this, the next weekend, we have AOCNA. Next slide, please. We have the second AOCNA Educational Symposium. Dr. Tipu, who is here as an expert, is leading the symposium. It is free registration for all the AOCNA members and very easy to register, $100 US. And the links are available in many of the WhatsApp groups here and also on the AOCNA website. And you can write to us, we can send you the link. And then I want you all to block your dates from 17th to 20th September 2025 for the 17th Asian Oceanian Child Neurology Congress in New Delhi, in Yashabhumi, Dwarka, New Delhi. And we'll be having some pre-conference workshop on 16th. So please block the dates and we welcome you. And this will be in conjunction with AOC in India. And so we will not be having the annual conference, which was scheduled to be in February. So it will be merged with this in September. So today we have a amazing speaker, but topic is also equally amazing and important: the humanistic challenges in current practice, the role of a pediatric neurologist. Dr. Elsie has spoken to us recently on traumatic brain injuries, and is Associate Professor of Pediatrics and Neurology, Boston University, and Director of Pediatric Trauma Brain Injury Program, the Boston Medical Center. And he has many publications, and he has been working on lots of boards, and he has written a book which he'll be talking about during his presentation on this same topic. And we have experts, Dr. Biju Hamid. I don't think I need to introduce to this audience, and he will give the overview from Gosh as well as the UAE, where he's establishing neurosciences currently on a sabbatical. And Professor Hassan, again, we are a dear friend from Turkey. We all know this gathering. And another friend, Dr. Tipu Sultan from Pakistan, who's heads the neurology there, and everybody knows. And our other friend from Sri Lanka, Dr. Jitangi, and she is a consultant pediatric neurology and Department of Pediatrics and Faculty of Medicine, University of Colombo, Sri Lanka, with lots of publications and awards. And to moderate the session would be our dear friend and alumnus, Dr. Vishal Sondhi. And he is a real astute clinician and a wonderful, amazing human being. Dr. Vishal, to you.
Thank you, ma'am. And I think we can jump right away, and the stage is all yours, Dr. Elsie, and we are waiting to hear to you.
Thank you, Vishal. I appreciate it. Thank you to Dr. Gulati for a kind introduction. It is an honor to be here this evening to talk about humanism in child neurologists. I would like to thank the Indian Pediatric Neurology Association and the Center of Excellence and Advanced Research on Childhood Neurodevelopmental Disorders for inviting me to share what we have learned since our publication of the book Namaste. I don't have anything to disclose financially or academically, perhaps to mention that everything started with a collaboration between Boston University and Harvard University to go deep and try to understand what is behind the practice of humanism in current practice around the world. How is this influenced by the political scenarios and the religious beliefs, culture from different people. And we came up with a product, Namaste, which symbolizes the acknowledgement that we're all on the same path towards the spiritual liberation. And we have ceded all of our copyrights to IGNA, the International Child Neurology Association, as this being a project that you all can contribute and improve over time. Our learning objectives today is to define humanism and to demonstrate that this is a core construct in everyday practice and education of child neurology. We will try to understand how the concept of humanism has evolved over time and to differentiate between humanism and professionalism, to demonstrate educational techniques to foster and encourage humanism, and to become familiar with certain resources like the Gold Foundation and our own book. There are many definitions of humanism. It's hard to say which one is the best definition. This is from Wikipedia. Humanism is a philosophical stance that emphasizes that the individual and social potential and agency of human beings, whom it is considered the starting point for serious moral and philosophical inquiry. In one sentence, what this means is that we are all interested in common things. And I'm going to underline the word common, not only for this definition, but also throughout the lecture. If you look at the Gold Foundation definitions, they make they value the most as the interaction between the physician and the patients, and how these attitudes and behaviors are sensitive to the values, culture, and native backgrounds of others. Humanistic medicine is a way of practicing medicine that emphasizes on this connection between patient and clinician, but is based on certain values that we all share as human beings, as inhabitants of this planet: empathy, compassion, and respect for the patient's dignity and beliefs. What is the impact of humanism in medicine? Well, it has been said that if you practice a good humanism in your clinical scenarios, then outcomes will be better. There will be a better job satisfaction within the group of physicians. There will be a less risk for malpractice litigation. It creates a balanced care system, uphold ethical and moral foundations, reminds us our own humanity, and understands the importance of touch. And I'll go through this entire conversation. But why this is more important, if you want me to say, in pediatric neurology, it is because our specialty puts us in difficult situations sometimes, in which we need to inform our patients or their families about death, brain damage, a bad outcome after hypoxic ischemic injury and a stroke, a hemorrhage, a trauma, or a status epilepticus. We provide diagnosis of neurodegenerative disorders that have dates of mortality. We share with the family the diagnosis of cancer and tumor. A disorder not responding to therapy could be a seizure, a demyelinating disorder, or an autoimmune disorder. Therapy is available, but so expensive that people cannot acquire them to take care of their children. Counseling about the diagnosis of intellectual disability is always challenging. Counseling about a bad prognosis. So you can say that humanism really applies to every second, every minute of any physician's practice. But for us, there is these special situations in which we need to be very aware of the importance of this practice to be more effective in what we do. There is some symbolism about humanism. First of all, this is not a new concept. It has been generated since the times of Hippocrates, and when he developed the Hippocratic Oath, the principle of do not harm, the respect for our teachers, for our students, for our patients, for their families. And this is symbolized in America and certain parts of the world with some rituals and traditions that come from millenniums of history of humanism as one of the pillars of the practice or the education in medicine. tomorrow I will attend a white coat ceremony of my daughter, who will be starting medical school at University of Massachusetts. And the ceremony it is in which the mentors will invest with a white coat to the new students. This will be a short coat, and when they graduate, it will be a long coat as the traditional European use. This has been challenged because why the white coat need to be white and so forth, but there is some symbolism that has been maintained in the traditions around the world to reveal how important, how pristine need to be the practice of medicine. Now, these days, practicing humanistic medicine in the world, it is very difficult. If you're working in certain areas like Gaza, for example, Ukraine, you're exposed to civil wars, conflicts, political unrest, hunger, poverty, difficult to access healthcare, the adoptions of new technologies are not available to everyone. The brain drain is a problem in particular low-income countries, and reasonable restrictions of immigration, prolonged years of life of disability as a result of the improvements of medical care in pediatric neurology, and still the more recently, the increasing number of people that are joining these movements, that the denial of science. If you guys have had the opportunity to visit the Golden Hall in Stockholm, you will see that there is this figure on the center that has on the right side to the west, on the left to the east. And if you apply this to the concept of medicine, Western medicine aims to treat illnesses using evidence-based treatments. Eastern medicine emphasizes prevention through lifestyle changes and maintaining balance within the body. But as the figure in the center of the Golden Hall in Stockholm, this is on the City Hall, a place that in which celebrations like the Nobel Prize ceremony takes place. It is in reality the union of both practices that I think it might have the best impact for the majority of societies across the world. And as we go through, you might help me. We can go deeper into these concepts. On the east, the views of health and disease as a balanced state, whereas on the west, the views are the health is separate from the disease. On the east, it considers the body as a whole, looking for patterns of disharmony. On the west, looks at each organ system individually. On the east, natural treatments like herbs, acupuncture, massage, mind-body exercises, Tai Chi, yoga. On the west, pharmaceutical surgery, PT, psychological counseling, curing diseases, managing symptoms, preventing disorders, supported by extensive clinical trials and research, and offering several settings, including private practice, whereas on the east, this could be done in churches or even personal homes. So humanism and economy, what is these rich and poor concepts? Do they have any impact on the practice of humanism? We try to hide it with a more tolerable language like a low and middle income countries, but the fact it is that poverty is an issue. And in low and middle income countries, shifting to humanistic care for neurological conditions invites stakeholders to address availability of medicine, poor staffing, and dysfunctional. This is very important. It's not lack of talent. It is not lack of skill. It is dysfunctional health systems in tandem with deep-rooted social and cultural beliefs, as our friend from Africa, Grace Akello, comment on our book, Namaste. Now, in the world, Europe is considered the global leader in healthcare. And within Europe, Norway and Netherlands at the top, followed closely by Australia. That means that the practice of humanism will be easier in these countries. In the US, ranks at the bottom of the rich countries, despite spending far more of its gross domestic product on healthcare. So not everything is about the money. It is possible to practice humanism in poor countries, definitely, but there are some challenges that you're very familiar because we all practice in similar situations. I'm originally from Ecuador and I practiced there before coming to America. Some say that humanism in Africa, and I say everywhere, gives hope to many people, especially children, and hope is the last thing that the physician should remove out of a patient or a family. There are different visions of humanism depending on where you are in the world. There is, I'm not sure you're familiar with the concept of Ubuntu in Africa that provides a secular framework for compassion, dignity, and reciprocity. However, the practice of humanism is not free of side effects, it's not free of risks. People like in Uganda have suffered vandalism, community smear campaigns, even car fires. Now, there is many long, well-written books have been dedicated to talk about humanism. So I cannot do full justice to explain this view of the world that we're living, this philosophy of life that is worth living, this approach to values and meanings applied to child neurology in just a few minutes. So we will concentrate on 3 elements. To understand the philosophical basis behind the humanistic thinking, I want to quote Andrew Hobson, one of the most prominent representatives of the humanistic movement in the UK, and take on these 3 concepts to give you some of the typical attitudes that are associated with a humanistic worldview. Something about reality, something about morality, and something about meaning. Let's start with something about reality. And it's pretty fair to say that broadly speaking, across the whole history of the human thought, as long as men and women have looked around and asked themselves, what is this sort of place that we're inhabiting? What's going on in here? What is this stuff all around us? What it is made of? How does it work? And other questions like that. There has been 2 sort of type of answers to these questions. There have been people in almost every time and every place who have looked around them and said, this is not all there is. The crude material reality that we perceive is just the screen in front of a greater reality beyond it, that we can approach and touch through a spiritual means. And then there is being another way of looking at the universe. People who have said, this, what we see, what we perceive with our senses is reality. We can understand reality by our observation, by our intellect. There are 2 thoughts that arise from this concept. One is the idea, in consequence of that view of reality, that human beings can understand the universe in which we inhabit, that it's possible to approach some meaningful knowledge about the world in which we found ourselves, that the universe is comprehensible. And the other attitude that arises from this idea about reality is that human beings are interconnected with the world we find ourselves. Many long, well-written books, as I said, has been written about this. But there is a second aspect that we need to take into account, which is morality. The second element. There has been also 2 ways of thinking about this. One view has it that morality is something that came to us from outside of the human being, that at some point is struggling and suffering and battling humanity, came outside from the human being, that at some point struggling and suffering humanity had a revelation of principles for living so we can live in some cooperative way. And obviously, those sorts of views of what morality is go hand in hand, usually, with the idea that morals equal rules. Rules for living to be followed, that the test whether something is right or wrong is whether to approximate to this pre-existent rule or commandment. Now, for humanists, morality is not something that came from outside of human beings. When we look our close relatives in the animal world, we can see all sorts of behaviors and instincts that lie in the foundation of what was conscious animals today call morality. For humanists, morality is something that comes from inside the human experience. And on this view, you can see very quickly morality is some sort of sympathy with other human beings. It's generated by our interconnections. It is about seeing yourself in the face of the other person and respecting them for the same reasons you respect yourself. Reason, empathy, and thinking about the best way to live are the consequence of this view of morality. The third element that I would like to talk about on the Venn diagram is meaning. There is a view of the meaning of life, that it has a purpose, is out there waiting to be discovered. You search around the universe, you study hard the trajectory of reality, the patterns that you find around, and in that you can discern meaning, purpose, intention. Reality is going somewhere. And if you search really hard, you might eventually, Indiana Jones-like, discover the end of your quest in a locked chest deep in a cave. The meaning that you have been searching for, and it was there all the time, if only you knew it. That is, however, not the view associated with a humanistic attitude. The view of a humanistic attitude is that meaning is not something up there waiting to be discovered, but something that we create. We create meaning in a sense of purpose in our own lives, that we are the ones who ascribe meaning to the experience that we are having, that faithful people can attribute to a creator, a superior being. These ideas found in combination can be discerned pretty much everywhere that there have been human communities writing down their thoughts. You can find them about 2.5 thousand years in India, 2.5 years ago in China, and 2.5 years ago in Europe, pretty much at the same time. And of course, they are all over the world today. And today we call to this approach of life humanism. Now, we are all familiar with the Hippocratic Oath I have mentioned earlier. And it's important because medical schools still require graduating medical students to take the oath. Hippocrates already established some basis to practice humanism in medicine when he said, "It's the physician's duty to benefit the sick and keep them from harm and justice." William Osler, a Canadian doctor who was one of the co-founders of Johns Hopkins Hospital and one of the most quoted physicians of all times, said, "It is much more important to know what sort of person has a disease than to know what sort of disease a person has." And this is something that the medical societies, the pediatric society, the pediatric programs of education, the fellowship programs, including the medical schools, are now emphasizing on their educational programs. So let us think about this topic instead together for a little while. And as we read through it in a slightly rambling way, maybe we all find points of intersection with issues societies have been confronting this year in particular, such as diversity, community, racism, belonging, and war. That influence how humans interact and how much concrete terms that we'll discuss in the next few minutes. We see ourselves instead quite properly as being on one far edge of the spectrum of those sort of humanistic-like behaviors, but the conscious attribution of meaning to experience and the spending time in trying to explore the question of why we're here, where we are going, what are we doing, and what should we live is a very human endeavor indeed. These ideas is important to understand or question ourselves. Can we apply in a very poor society? Can we as physicians remain humanistic in a very poor environment? And to answer that question, you need to look at our patients and think carefully for a minute. We all have seen extreme poor people that have opportunity to smile. We all have seen people that seem to be happy despite the number of limitations that they have. And this is something that is inherited to the human species, the resilience to survive for generations, situations of disadvantage, until at some point, a group, a percent of this population might encounter a way, a path to go out or to move out of these restrictive environments. Yes, happiness, it is independent of fame and money. There is a lot of people with all of those idols that commit suicide or have a very hopeless lives. So it is important for us as the physicians to empower the patients in these situations, no matter what the restrictions for these are. Now, it is important to remember that the human condition is one of vulnerability. Our fate may be terrible. There might be no consolation. However, in that view, in that tragic view, it is also the solution, because thanks to that, then the human power gets the opportunity to show and try to find what it is freedom and to what it is happiness. If you read the Constitution of the United States, one of the first statements is that it guarantees the freedom for the pursuit of happiness, freedom for fear, for pain. But this is not a new idea. This was written by Epicurus in 341 BC, and it refers to the creativity, to the relation of humans with others, to the combination of internal and external sources, and the pursuit of personal development as a way to justify our goals in life. This is probably the most important thing from a physician's standpoint, right? How do we make sure that over time, instead of getting overwhelmed, getting tired, frustrated, how do we give us opportunity to be happy despite having to see 100 patients per day? I was told the other day in one of the centers in Asia that the physician needs to see. How do we do it? And we do it through this connection with every patient. If it is a gesture, if it is a phrase, if it is that is enough fuel to complete the task that we have to do every day. Now, human nature is not a machine to be built or remodeled. We need to cultivate it every day. That's why it's important to keep learning about not only medicine, but the culture around us. And indeed, that includes a humanistic approach, humanistic concepts that we can apply in our daily practice. This is not a new concept either. It was written by Stuart Mill in his book, Liberty, in 1859. But physicians have to face several barriers these days, right? We have to face lack of resources. We ask to see more patients. We receive less financial incentives. We have to complete a lot of administrative tasks that takes off time from our patients. If we only concentrate on the challenges, then it will be very difficult for us to reach a steady state of happiness versus challenges that will allow us to be in the best position to help our patients. So what is that the physician can do to overcome these challenges? Apart from empowering our patients, it is important that the physician of today become an advocate of the patients individually, but also collectively. Physicians usually are very smart. They are screened to get into medical schools. It's imperative that that intelligence is being used so politicians that don't have the same resources on their mind don't dictate on how medical care needs to be applied in our patients. Now, this it is very common for patients to be, sometimes the patients could be difficult. And when the patients are difficult from the physician's point of view, we immediately have this instinct to label them as such. However, that is a mistake, because if we, instead of thinking like that, we will think on why is that the behavior, why is this patient behaving like that? What is behind this? Perhaps we might understand that even ourselves will do the same in a similar situation. Violence on the medical environment is not uncommon. There was a study out left upper corner, as you can see, that everybody on certain on hospitals environments have observed, almost everybody, 95% of disruptive physician behavior. That nurses have left places because they were mistreated, up to 30% on the right lower corner. And that respondents were aware of potential adverse events that may have occurred as a consequence of disruptive behavior, and up to 60%. So disruptive behavior has consequences in outcomes for our patients and for ourselves. Nobody who engages into disruptive behavior ends up on a state of happiness. And so it is important to understand that a humanistic approach needs to be used in every second of our practice, with some extra details at certain points or during the consultation or during our relationship with the patient that makes the patient knows that we care about the individual. And that will have a direct impact on the quality of a patient care. That will give us better patient outcomes overall, improved adherence to therapy, and increased patient and physician satisfaction. Now, there are several recipes, because in America, they love to give recipes for everything, right? And so for those ones that are interested in that, the Gold Foundations have a couple of acronyms that like people, pediatric neurologists, to learn about. And that will be IE CARES, so I for integrity, E for excellence, compassion, altruism, respect, empathy, and service. But learning an acronym, it doesn't mean a mnemonic phrase, doesn't mean that you're going to be able to apply these all the time. This is like everything in life. It comes with practice. The more you practice, the better you get at it. There is another acronym that you might want to remember. It's called the 5 T's: time, talk, tact, touch, trust. And those are important qualities if you really want to increase the level of your care. At this point, I would like you to use the next few minutes to reflect on what other physicians have been thinking about humanism in medicine and in pediatric neurology, and how do they conceive the practice of humanism in current lives. So it is the golden rule, it is to treat others like you would like to be treated. For this case, patient-centered care, it is better to twist the golden rule and to treat others the way that they wish to be treated. What I'm going to say might sound a heresy, but when the patient comes, after a certain point, the patient should be the boss. You should try to understand what the patient wants to, what is behind his beliefs, why is he making that choice, and you should be there to empower those, obviously with limitations of reason. Find common ground with the patient despite the obstacles and become a problem solver. Show empathy, acknowledge these emotions, and don't forget the extra touch. Humanity goes beyond science, but both together, as we're trying to demonstrate today, go hand in hand and improve our medical care. Now, humans in general, we all are social animals. We need to connect. That's where we're having this meeting, this conversation. We matter to each other. Nurture the relationships is very important. It's like when you get a plant, you need to put water if you want it to make it survive. And that's the way we keep our friends. And that's the way that we should keep our patients, with respect. Patients are not numbers. They are not collections of symptoms and signs. It's not the patient with cirrhosis or the Guillain-Barré patient or the Miller-Dieker syndrome. It's not that. It's an ex-patient who happens to have a disease. This is very hard to teach in medical school. This is very hard to teach in a lecture. This, as you all know, for your years of practice, the best way to do this is to teach with example. It is by observation. It is by the students will see what you do, the gestures you do, the decisions you make, the way that you say them. It's important to use appropriate touch, eye contact, depending on the cultures. Some cultures touch more than others. Hugging in America will be inappropriate, for example. So it is important to understand where are your demographics, what's the culture of where you live. Smile always if it's possible. Asking what you're interested in might help you open a conversation. Try to find something in common that will keep the conversation going. It will make it easier to take the history, and you will be told details of the history that other seasoned clinicians will not do if they don't practice humanistic skills. Reach out to the human being in front of you with dignity and value the moment. Even when we are giving bad news, there is a connection. And that connection is established when at the end of a very difficult conversation, the mother or the father stood up or stands up, or they come to you and then hug you and show you their appreciation or tells you something. Don't try to fix everything at once. It's difficult, but one thing at a time. Make sure that in doing that, you find satisfaction. Because if you are satisfied with yourself, then you can be good for others. This sometimes it's not noticeable in daily practice until a patient say goodbye. And at that moment, you know that they come and hug you, and it seems like there is a separation from a family member. And then you know that you have accomplished a human connection. Even when the outcome is not good, sharing, helping might be very meaningful to the patients. This is a process, be realistic, and check up best intentions versus constraints. It's important to remember why you came to medicine. When we interview medical students for medical school, potential medical students, if you ask them why you want to study medicine, most people answer, because we want to help people, right? But then if you explore a little bit deeper on that, not everybody can give actual examples on how they have helped people in the past. So it is extremely important for those that are in medical education to make sure to ask the right questions, to screen for the right people. It is extremely important that we bring to medicine talent, but it is extremely important too that we bring humanistic people that are talented at the same time. Then we can assure the patients are going to continue to be well taken care of. It is difficult to believe that a patient, you prescribe medicines and you don't care on the patient. It is just doesn't match the thought. And it's important to understand what it is altruism for your patient. It might not have the same meaning as for you. So you can apply law of kindness, humility, and genuine curiosity to learn about the patient, depending on the situation, depending on the circumstances, the religion, the culture, as we have proved in Namaste, as we learn through Namaste book. Need to have patience and dedication, of course. Now, this is not too long ago, our colleague from UCLA in San Francisco, Lindsay Ryan, published this fantastic article about a patient that she had that the patient required a leg amputation, but he is homeless, and he told the doctor that he does not want to let her amputate the leg because if he goes like that to the street, it will be the end. And in that case, that we will prefer not to receive antibiotics, go to hospice and die, rather than to go through all of that, unless the physician or the hospital can find him a housing. So obviously, it was impossible to find housing in California for those ones that have been there recently. The problem of homelessness is extreme. And so the patient, to make the long story short, the patient did not receive any treatment at the end, died in a hospice. And this is what we can consider now a new diagnosis, the end stage of poverty, that we are all familiar in many countries around the world. This is difficult to remain cold in a situation like that. And because this cannot be solved in our office with good history, good exam, a good critical analysis to produce a good formulation, then what's the solution for this? The solution it is that we need to become advocates, and we need to organize ourselves, and we need to be part of medical societies, but also as our leaders to take a stand and a say. Being a doctor is a privilege, being able to be part of the children's lives and their families. You need to be good with everybody, but you are not going to be that unless you're good to yourself and your family. Try to isolate, try to privatize some time for your family and for yourself so you can have fuel to come back. Appreciate you being a human yourself. And so you can ultimately know what is the person feeling and how you can help other people. There are several qualities, there are several mechanisms in which you can use to do this in everyday office, everyday practice. And most of you do it, but some of us cannot do it all the time. And that is always the situation in which a patient has been calling several times about the same problem, or there is some families that might have a certain agenda that we do not like, that we do not appreciate. Instead of being judgmental, it is important to understand what are the basis for that, and then with any of those behaviors that are listed in front of that, then we should be able to take care of that. We practice now patient-centered care, but family-centered care and informed-centered care is very important part of the similar equation. There is a global revolution, and there is improvements around the world. This is from Africa. What is the recipe to develop better services, to make it more humane? Well, we need to develop more pediatric neurology programs across the world, caring versus curing. We need to make sure that in this idea of super specialization, to do it, but without dehumanization, to educate the healthcare providers and the populations, to educate from region to region, but not from above to down. Be reciprocal. Is a double way, is a highway. It is not from I know and you don't know. It's better to learn. We all have something to learn from each other, and that is respect to local beliefs and cultures, addressing social and existential experiences, de-stigmatization, and of course, advocacy. Now, if you want to give bad news, and you also want to have a mnemonic, a recipe for that, then you should remember spikes. Establish an appropriate setting, check the patient's perception of the situation, invite the patient for information, determine the amount of information the patient already knows or wants to know, respond with empathy and explore the emotions raised during the interview, and establish a strategy for support. The way that I do it, I actually keep the paper on my hand and make sure that I go with the checklist just to make sure that I don't forget under the moment of stress, under the moment in which a lot of people are talking, I might forget one of these important steps. Over time, you become familiar, but nonetheless, you want to make sure that you check them all. Now, how many people you think have humanistic values? Do not assume that everybody is thinking like us. We cannot. We need to try to understand why is that some people might not be able to understand us, or we might not be able to understand from them. 1 in 5 people have humanistic beliefs and values. So that means that there is a lot of people who this conversation might be meaningless, right? People might prefer to hear about what is the latest treatment of status epilepticus, or for 1,000th time, what is the best treatment of neonatal seizures, or autistic spectrum, right? It's just something that is in fashion. However, this is something that we use all the time. And this is extremely important to maintain in our medical education, and also in our education when we have somebody that is shadowing us, a student, a resident. And so we need to be patient but firm, and we need to be happy with what we have in order to make other people happy. I remember this in Cuba. One time I did a neonatology rotation trying to learn how to transport babies that are very sick from one place to another one in air transport. And the physician, the director of the neonatology, the NICU, a very intelligent young man, told me one time, he said, Alcy, said, why do you think that we need to study? And so I said, oh, of course, because we want to know better so we can help our patients. He said, no. The reason why we need to do this, it is because there are so many people talking nonsense without evidence that if we don't read well, we wouldn't know how to help. And so knowledge is important to avoid frustration. Now, I'm not going to go through every item in here, but this is just to show you how do we evaluate our students for humanistic skills. And as you can see, we measure the frequency in which we have had interaction with the student. Then we see how he has used the humanistic skills on patient care, how he has used that in practice-based learning to correlate with other colleagues and members of the team. How does he communicate with others? Does he has effective listening skills, or he is ignoring? He wants to cut short the patient and just apply whatever he has in mind. Is he showing professionalism? Demonstrate respect, compassion, integrity, demonstrates ethically sound practice, sensitivity to culture, age, gender, and all of these items are graduated or scored from 0 to 5. So we can actually have a longitudinal growth of our medical students during the 4 years of training. And here, I only use this as the coordination of care, so you can see how deep this can go in our evaluations of medical students, from demonstrate knowledge of care coordination to improves quality of transitions of care within and across healthcare systems to optimize patients' outcomes. And look about these steps, these milestones of growth: level 1, level 2, level 3, level 4. So from the simple demonstration of knowledge of coordination to more complex patients, to complex situations, to coordination of systems, and to finally being able to teach through role modeling about these important skills. So yes, these are long evaluations, but when you do it with the student face-to-face, very important in the terms of making a difference on their training and on their future. At the end, this will have an impact on patient care. Now, there are lots of physicians that I could have highlighted in here, right? But we want to talk about Dr. Robert Gold briefly, because he created a foundation that is dedicated to the education about humanism across the world. For him, being empathetic is extremely helpful, in particular, the bedside manners, compassionate care. It is critical to be the best you can be for your patients. And you're only half a physician if you're just good at your craft. Science is not enough. And you can see that. There are many physicians that are not the ones that know the most, and they are very popular within the population. He told me the worst news in the most loving way. If you become that physician that can give the worst news and be appreciated by the patient, I think we would have done more than a good job today. Now, there is important to maintain the optimism, right? Because people might say, well, but no, we have so many slums, so many people that are in poverty, so many problems, the governments, our administrations. And so we should remain courageous. We should remain motivated and keep a little bit of good sense of humor so we can continue to make progress in this. It's important to show quality of character, to fulfill potential and of human needs can be improved, change values, redirect individuals by process of personal change and evolution. And it's important, as I said at the beginning of the lecture, to do not take the hope away. Now, instead of boring you with more theory, I want to show you the faces of several of these patients, right, that we see in the office, and that reflect that behind every face, there is a heart and a soul. There are many stories, unique stories that I'm sure will make you feel as a great human being that you are in the broad sense of the word. Conclusions. Humanistic values are intrinsic to the practice of medicine, including child neurology. requires motivation, talents, virtues, and respect for children and their families. A genuine effort to establish a meaningful interaction that goes beyond patient care is probably the best approach. Physicians should educate, practice, and advocate for humanism in child neurology around the world, and you can use these sources for more in-depth learning about these topics. The Gold Foundation has lots of materials, and our book, Namaste, certainly. And with that, I'm gonna say that thank you very much. And I want you to remember, like with Roy Bennett, be the reason someone smiles, be the reason someone feels love and believes in the goodness in people, and try to do that every day. So thank you so much again for the invitation, and now I'm open for questions. Vishal?
Hi, Dr. Elsie, it was wonderful. And if I can use one of the phrases that you used, that the essence of humanism lies in how can we help not just physically, but metaphorically, philosophically, and in various other domains which go beyond descriptions and beyond measures. And I think it's to again take it from pediatrics, it's a developmental milestone which we have to achieve in our medical curriculum. It's a milestone which some of us maybe fail to achieve. Thanks a lot for a wonderful talk. We are open for questions. Anybody who has any questions can drop it in the question box. In the meantime, we'll ask the experts for their comments. We can, and Dr. Biju, we can start with you.
Thank you, and thanks also. Very thought-provoking and illuminating as always. Plenty of food for thought. I was looking at that, that picture that you showed, the good life, the 5 children sharing a bowl of rice. And it's one of the major problems that, when we talk about pediatric neurology, essentially we talk about neurodisability, don't we? And one of the major problems that people who have practiced in both situations is the disparity in healthcare, isn't it? The lack of equity in healthcare. And I know outside of the clinic, humanistic practice would mean that you advocate for more resources for these children. You make sure that disabled children receive all therapies irrespective of their socioeconomic status. But that's not really possible in reality. Yes, you can advocate, and that takes time. But do you think that in the absence of all this, given that there will always be some disparity in healthcare and lack of resources, how can, by a humanistic approach, you can still make sure that these children continue to live a meaningful life with independence and making their own decisions, etc.? How, for example, we who practice in insurance-based systems, we can use the 5 T's. You can have all the time, the talk, the tact, the touch, the trust, everything. But how do we still tell them that because your insurance don't cover, you are not able to access the treatment that I would really like to give you? How does the humanistic approach help in that situation? How do we still make them happy?
Excellent question, Biju, excellent. So it is not entirely true that it is impossible. So for instance, I want to give you examples in a high-income society and a low-income society. In high-income society, for instance, if you belong to the American Academy of Pediatrics, the section of global health, with the one that I'm very familiar, then the American Academy of Pediatrics has a lobbies in Washington to influence the senators and the representatives. And if you push for funding, then funding is being granted. It is being granted not too long ago for the children in Gaza, including not too long ago, this year, after a lot of pressure by the members of the American Academy of Pediatrics. On the low-income country, okay? I'm gonna use the example of Ecuador. Okay, so at the beginning, we thought when I was in medical school that just like you, that is impossible, because every time we try to fight with the government, it ends up on a battle in the street, and it doesn't end up on any solution. Yeah, I know it's hard to imagine Dr. Torres as a revolutionary person, but if you don't see that there is a solution, then yeah, I have been on the streets. But it didn't take me much anywhere, but we developed a little brigade, right? And we went to the place of the garbage, where the people will live there just trying to find something on the garbage. And we offer them care. And this is as a medical student, a group of medical students all years, right? From 7 to, and we were able to produce some change. It is important that we do not limit ourselves thinking, oh, let's do a global solution or nothing, because then nothing will happen. Just like you're saying. I do think that physicians are very busy human beings, and we're not paying attention to advocacy as we should. This is really a message I want you to think. How many politicians around the world are dictating how do we practice medicine? And you can tell they don't have the rights to do that based on their education, their training, their knowledge about society. So I don't want to say that, you come here, giving a speech and fix the problem. But next time you walk out of your room, you go into the street, and if you see the people under this mirror of humanism, the world will be better even for you. It is independent of whether you believe it or not. I don't have to be a believer to do this because otherwise, if I do this, I'm going to get a gratification of the eternal life. This is not about that. This is just so you can enjoy more your time as a human, as a doctor. And so, magical treatments, no, but there are some possibilities. Right now, I'm working with a group of philanthropists, now that I have a little bit of influence, to try to develop a neonatal screening program in Ecuador. Yeah, 20 years ago, nobody would have listened to me. So it's important that if you get to a platform, if I get to know all of you now, and I was so fortunate that I lectured twice in less than a month, that it doesn't stop here, that I take this to another level and try to do something. That's my message.
Absolutely, fantastic. And in fact, that's a very take-home message for all of us, also, because as physicians, I think we have a moral obligation and a duty for advocacy. And I think associations like ICNA, like AOC, and we should really be putting in more influence on these policy makers. And I don't think we are doing enough on that front. We talk about it, but perhaps usually it ends with just a paper in a journal. That's it. It doesn't really get to the people who should be reading it, and that's very, very important. There are no easy answers, but often the focus is on education and research, which is important, and advocacy is often left behind. And there is a problem. And because you talked about connection is very important. And I feel that with all these technological advances, AI, genetics, imaging, everything, that technology is often overshadowing the human connection with the patients. I think you should use these tools, but still the approach should be holistic. And I think we often focus on cutting edge, while we miss the ground reality. Yeah, true.
Thank you, Biju. Appreciate it. We're in the same boat. Remember that.
I wanted
Dr.
to
Jittangi?
add, Vishal, just
sorry.
1 second, just I want to raise hand because of one thing, because of in response to what Dr. Biju was saying. Dr. Biju, what you're saying, it's not only with books and chapters and all that. We have to ensure for advocacy, and I know that I'm happy that today that there was some WHO regional thing was decided for rehabilitation, and there was something in the ministry for pan-India thing. I got this humanism added along with destigmatization and all that stuff added, and looking at the the parents and parent side. So I think those names, those words, they did not know in that room. And I have actually sent everybody the thing for this meeting also, trying to say that we are trying to work on that. So I think we have to push. We all of us at some point of time are in many committees and all that for their various governments of their countries. So I think that we should do it. So I think that is it. And I think all of us who are in the call today are actually very much committed to this, and they want to understand, they want to feel it that way, and trying to understand from Elsie and you and everyone how we can ensure that others do the same. Sorry, Vishal.
And also it's not one size fits all, because you can have a international perspective on how you approach childhood disability, but if you don't care about the cultural sensitivity, it's a complete loss, because the perspective of disability is different in different cultures, and you have to take that. You can't just impose our view, or like the Western view of disability, into a very orthodox, closed community. You have to, and there's no point in advocating for changing their cultural views on disability. You should be able to appreciate their culture and be inclusive.
Absolutely. And I think one first important thing is destigmatization, which is a big problem in our country. Even in our doctor community, people don't want to share the diagnosis. So what you think about the non-doctor community? Because I have many colleagues whose children have some issues and they don't want others to know about it. So, I mean, so destigmatization and all, also I got it listed in their points. So I think that is important. You're very right. It's just that learning is there. Learning curve is there. You can learn the things and think. Obviously, you can't. Very right. You can't just have a system what Elsie is following in Boston cannot come here. And you have seen Gosh and UAE, both are different, right?
Absolutely.
Absolutely, Shefali. But I can tell you that when I was practicing in Ecuador, I saw the same smile on the patients that I see in me here. I didn't have the technology, but when I remember that, even on the mountains, even far away from the capital, just by the human contact of having somebody to help. Now, I know that the ability to help for me was very limited. I didn't have any cardiac resuscitation, anything, right? The government just sent you 1 year to be in the mountains and you are the doctor. But people needs to have somebody. So even in an extreme, limited situation, there is still some good that doctors can do. Not only doctors, humans can do by supporting, empowering, being empathetic, trying to help.
Dr. Jittangi, your perspective on this?
You are muted.
You're muted. You're muted. Can you unmute yourself, please? Yep.
Sorry. Good evening, everybody, and thank you so much to Shefali for having me, and also thank you, Dr. Elsie. That was a very inspirational talk, and there was so much actually to think and to reflect, and also I think we are from diverse backgrounds. There were many aspects which were common, but also you very rightly showed different aspects from the Western as well as from the, high income as well as low resource settings. As I was listening to your talk and I was being futuristic and I was just wondering, we all have a certain, blend and a feeling of humanism. I think that must be one of the reasons which has driven us to be in this. And also particularly we share that, looking after children. But on the other hand, I'm not really sure it is a universal concept that we see among all, people who practice. They may have it in small, amounts or large amounts. It's very variable. So I was just thinking, how do we, put forward or make this a regular practice, and how can we campaign for this? So I was thinking, one of the best ways would be how we instigate this in medical students, from young age. So as you were talking, I was reflecting on how these things, these concepts, and the aspects that you were talking of, how can we instigate that in the future generation? So my question or my comment was, actually I was thinking of that as one of the very forceful methods where what you suggested, the concepts and, aspects of humanism, you very beautifully, took us back to the history to show it's something that has been there and it is something that we need to be aware of and be part and parcel of everyday practice. So I felt one very strong methodology would be to instigate it into the younger generation, and which is going to be the future doctors, and that would be through medical education. So I would like to ask you, as everybody said, you can't enforce, you can't teach people to be humanistic, but I'm sure there are methods how we can take it to that level. So I just would like to ask you about what do you think, and what would you think is the best approach to it? What I'm suggesting, have you experienced and have you, involved yourself in this, aspect of humanism and in teaching medical students? And I would like to know your reflections.
Thank you, Dr. Jitangi. Did I say well? So first of all, nice to meet you, and thank you for coming to this presentation. And then with respect to your question, very important question. Yeah, I wish that I could say, oh, this is my original recipe, but I'm going to share what America does at the moment, and I think they are doing it right. And then we can see how we can apply this in other societies and what can be done. In America, screening the people to become a doctor is a very serious process, and it's not easy to get into medical school unless you prove a sound record that is academic, but more importantly, that assures that you have the humanistic traits that are needed in medicine. And the way that this is being done is this. So you have your MCAT, which is your exam before getting into. You have your GPA, which is the grades from the 4 years of college. But then you have to explain what are your social service experience. How do you spend your extra time and trying to help people? So that's why on the lecture I said, it's not enough to say, oh yeah, I want to help, or you want to help in the future, but what you have done in the past. And so we really pay a lot of attention, because everybody gets good, in a big country like this, you can have perfect grades all across the country. So how do you differentiate between one and the other candidate? It is on the social experience, social service experience. And that counts a lot to get into medical school. But also the letters of recommendation. So people like you will have spent time with a student and will write about whether this person has or not these traits. We ask for 3 letters. So that's what America does. And then once the student that was already highly screened gets into medical school, you know, the 2 or 3 slides that I show are exact copy, a piece of the evaluations that we have that are so detailed, so minute, that obligates to the faculty to offer very clear feedback. And so people, even though if you're going to be a surgeon, sometimes they are less empathetic sometimes. And then on first year, but then on second year, they have been hearing about this and then make progress. Now, you cannot do this if you are in a, your medical school only deals with one single population. If you're only dealing with the rich, I'm going to just say, then it's very hard to teach how to be sensitive to the poor at the same time. So one of the things the medical schools here do, it is that they send the students to different places. For instance, the pediatric program in which I'm involved, okay? This is a combination of Children's Hospital in Boston and Boston Medical Center. Why do you think that there is this combination? Children's is the superpower, right? Where all the people that have a lot of money from all over the world come. But Boston Medical is the urban center in downtown Boston, where all the people that have no insurance other than the state insurance come for attention. And the program is combined because the idea is that we cannot graduate a pediatric residence without this diverse experience. Now, this is not a conversation that it starts now. If you go back in history, Ortega y Gasset, a Spanish philosopher, argued that the medical schools on those days, 100 years ago, were not teaching about humanistic traits, culture. And that's why physicians are so cold at the end. And then it has been waves, more humanismo, less humanismo, depending on which country or which person is on every faculty, as it happens usually in other countries. So, but how we can do it in other countries? Well, there is an advantage of being in a poor country. I was in one of them. It is that when you're exposed to poverty so much for so long, it is incredibly hard to believe that you at the end will end up on a stone, right? I still remember the first patient I lost because a 42-year-old woman with leukemia who cannot afford to pay platelets anymore at the end, at the beginning of my call. I started at 5 p.m. I was a student of the last year, an internship, which is part of medical school, and she couldn't buy anymore. And I battled the whole night, right? So it is very hard to imagine a physician that faces such situation that is not sensitized deeply. And as I have been, I imagine that everybody faces that. It will be hard to imagine that they have not acquired enough skills to pass it on to generations. In fact, when in America they tell me that, oh, how is the education in other parts of the world? I said, it's great. We just don't have the systems well. But the education is good because how come it happens that for centuries, people is alive? If there will be no good physicians with no humanistic traits, people will not be alive in any country, right? We do have good people. We just need better processes, better systems. I hope I answered that, your question.
Yeah, thank you so much. I think I do agree. I think in US you have a very stringent, methodology for selection, but I'm not sure whether we in our region, can say the same, because most often the entry criteria is based purely on merit. So it does become an issue, but I wholeheartedly agree with what you mentioned. Yeah, thank you so much.
Dr. Hassan, may I have your comments, please?
Thank you. Good evening, everybody. Good morning, Yassi.
It's
Thank
good
you
to see
so
you.
much. Yeah, good to see you. I really enjoyed your presentation, and thank you very much for your global vision on the humanities and also your reflections from the Namaste project. I really enjoyed that. I'm totally agree with you. The humanistic medicine in future will be applied to the personalized medicine. Is a part of the personalized medicine and personalized care. Sometimes there are some restriction area for the evidence-based treatment, but I think the humanistic rule easily applicable to the personalized medicine side. And also, I agree with you. We educated ourselves, our students, and also we have to be educate our societies. What is the humanities rules? So we apply to humanities values to the population. What do you think about the education of the population for the humanitarian rules for using the social media? Social media, is it possible to apply the humanistic rules to the on the population in different countries? You also clearly discussed about that humanity rules are different in the Eastern country, different in the poor country, different in the rich country. Is it possible to use the social media to educate? And also, my second question: for the curriculum education in the medical school, is it possible to humanistic medicine to be involved in the behavioral science to the education time in the medical school?
It is possible. It is possible.
Yeah.
So there has been already some efforts. Social media, I think, is very powerful, and so I
Yeah.
think if you repeat the message over and over, like a marketing, any principles of marketing, right? Then eventually it sticks with the people. It is a process, though. When we start talking about humanism in the International Child Neurology Association, and Bijou is here, he can tell you. I mean, it was not easy. It was not like, oh yeah, come here, have your position, have a talk, and everything. It was not easy because people are not convinced that this is attractive enough for physicians. Even you're talking about population, but for physicians. And so what we would like to do, as Bijou can tell you, we would like Namaste to be open to everyone. Any member of IGNA that thinks that you can improve one of the chapters should have access, send the chapter, and we improve that, right?
Yes,
just a
possible.
continuous project of just a renovation. It doesn't have to belong to one person. That's very important. It doesn't have to belong to one individual or one organization. It should belong to IGNA, and IGNA should use that as to educate new generations. Now, Bijou is an expert on social media, so he can use all of that. However, to answer really your question, right, it is how do we educate the population? All right, for that, we're gonna need the government. Our power as advocates need to be at the level in which we can influence the government, because remember, it's not in the best interest of our governments to educate the population, right? A lot of our populations are illiterate. They don't have schools. So not even for the simple things, even less for humanism, but in the doctor field, in the ones that we can influence, I think is more doable and it's more out our reach. Now, medical schools don't have time for this, right? But it doesn't have to be a specific lecture. As I show you on the project from Boston University, these are traits that are measured in every interaction. So even when they practice the medical interview with the actor, then we already are grading them or scoring them on these issues. We see whether they make eye contact. We see if they care about the question. You see, sometimes when the students they are looking down, like a reading on a paper, they cannot even because they are thinking on the problem. But as time goes by, like all of you good clinicians that you are, you realize there is a moment in which more important than knowing the medicine is understanding the context in which the medical interview is going to be done. Then you become more effective, right? And I think it's by role modeling. And this is something that medical education in the entire world has functioned for generations. Is a young physician that is following the old physician who is considered in the community as the one that knows, or in it is medical education or it is clinical people, but that's the way that it's been done, because otherwise this would have disappeared as a profession. But to be more effective, social media is a good way if it is sponsored by an organization like IGNA or the CNS. And so now we have received I think the door is open, right? But we're still not as good as, this will be my, I'm going to propose this to you all, okay? This will be, you know how these days we all need to answer the question of diversity and inclusion for every lecture, right? Even though there, we might not be diverse for that lecture, we might not include everybody, but we need to answer that question, right? For me, it will be a victory if one day, no matter which topic you're talking about, that at the end you put a slide and talk about the humanism and how it relates to the topic you are talking about. Because that will force you. I'll give you a practical example. The treatment for SMA, right? $2 million, okay? Fantastic, everybody goes and learn. I'm walking out of the auditorium, I cannot prescribe to anyone. How that is helpful? But so the person, the doctor who's giving the lecture, the conversation, should go through the analysis. And we should not be afraid to touch into sensitive issues of government, of our own organizations, of our own beliefs.
Thank you, Elsie.
Thank you, Hassan.
Thank you.
Dr. Tipu, your comments, please.
Thank you, Elsie. It's amazing talk and a topic which is very close to my heart. In countries like Pakistan, where we are dealing hundreds and thousands of patients with a huge number of challenges, including economical and, of course, resource limiting. But I strongly believe that how quickly we are heading towards this technology era leading to whole exome sequencing, genetic testing, immunological, radiological, etc., and heading towards, as you just mentioned, about the $2 million therapy for SMA, and the next in lines are these sort of genetic therapies for Duchenne muscular dystrophy. But at the same pace, or maybe at the faster pace, we are moving away from this humanistic touch or empathetic touch in our, sorry to say, in our young generations. Though those who are relatively older generation of my age, or many of us sitting in the panelist, but as far as the youngsters are concerned, for whatever reason, as we just discussed about the lack of this topic and the undergrad med school curriculum, or maybe during the postgrad, or maybe because the overall context, global context of more materialism, we are moving away from this humanistic or empathetic touch. So I strongly believe, right from the beginning, may not be from the med school, but probably even before in the high school era, this humanism should be part and parcel of the teaching at the even high school and pre-med school era. Secondly, I think at the same time, when we are teaching medicine, when we are teaching about this robust technological investigation and therapeutics, at the same time, we should also teach maybe with the clinicians, whether pediatric neurologists or the pediatricians or everyone in this field of medicine about this. You rightly mentioned about the different stages of care and different stages of compassion. However, in resource-limited countries where the doctor-patient ratio, where the doctor-patient-nurse ratio, and all the care providers is not appropriate, probably, I'm sure Shefali and many of this Southeast Asian region would agree with me that might not be practical. I still remember many years back when I was in training way back in early 21st century in UK. At that time, I, as a resident, as a fellow, I used to travel to the homes of different disabled children. So as a community work, along with community worker and couple of fellows and the community nurse, we are bound to see some of our patients maybe on monthly basis or maybe at the quarterly basis at their home. And that's how we were actually not only visiting, managing their day-to-day problem, but actually witness the environment and their actual problem. So that sort of component is actually lacking in current practice, and I'm sure is not a routine practice in many parts of the world. So, and that might not be an easy thing. Like in Pakistan, it might not be an easy thing to propose these sort of component in the training to visit the patient, because we are dealing with hundreds of thousands of patients. So I think task is quite challenging, but still I'm quite optimistic if we incorporate this sort of curriculum in undergrad level, in the med school, and of course at the postgrad and the fellowship level, and all the maths teachers and pediatric neurology, of course, since we all are sitting here are pediatric neurologists, then things would have been a bit easier to spread the knowledge, spread the noise, and I think that should be the way forward. Once again, thank you for teaching us, for enlightening one. It's very important topic, which is of course really important in this era of technology. Thank you once again.
Thank you so much, Tipu. I really appreciate your words, but it's not teaching, it's both of us learning and enriching the conversation. I think that's the most important thing. I would like to...
Elsie, there are two questions.
For those ones that are coming
in the chat box.
Just 1 second. For those ones that are coming to the CNS, you're gonna hear Charles Hammond present a humanistic view on patients with cerebral palsy. And one thing that I'm gonna say is that there is Tipu touched on this, and I want to underline this. If you get the chance to cohabit, to live, to share your time with one of our patients for a period of time, it's a changing experience. You'll understand much better the patients. You'll understand the value despite of the limitations. Definitely I agree with Tipu, Tipu's advice. Thank you. And now let's go with the questions.
Yeah. One of the guys, anonymous, so he or she writes that empathy is the most powerful tool for change. But how do you address the stigma that pushes up against empathy, which exists as much amongst the medical professionals as amongst others? So how do you address the stigma?
So I think we have been talking about this all along, but just to make it simple, education and good screening of who is going to be a doctor. I think that is important. Our societies need to screen better. It is not good enough to come to this profession to have a financial security. It is not good to come to this profession for fame. It is not good to come to this profession for social advance. All of that is fair if you come to this profession to help others and you have the talent and the altruistic or humanistic spirit to do it.
There's another one. I think this again has been addressed at great length. Is walking all the miles and taking all the pain to care for child really humanistic medicine?
Can you repeat that, please? I'm sorry, I didn't.
Is walking all the miles and taking all the pain to care for the child really humanistic medicine?
No, I don't think it's practical to remove all the pain. No, I don't think that's practical. I don't think the idea about humanistic doctor is to remove the obstacles. I think in part of the lecture I said that tragedy is actually good, because in that crisis is that the human being finds the resilience. And this we can find as an individuals, but it also happened as an species. Humans have been at the brink of extinction several times for the planet. How is that we are here having this conversation? Right? So it is not impractical, but it is not also realistic to try to jump over the hurdles. There is no shortcuts in life. I mean, you can try, but there are no shortcuts in life if you really want to do it well. And for us physicians, and in particular in this topic, I think we need to use it. This is a very important tool to keep our profession in the way that has been practiced for many years. In the faces of artificial intelligence and other technological changes, it is extremely important that we defend the stance of humanism, because otherwise our patients will be suffering. And when we say patients, we're actually saying the same people that are making the rules. They just don't see. For some reason, it's hard for people to see what is coming. We are all human. We are all mortal. We are all going to get sick and die. What is it so difficult for some people to understand that? All right, enough for now.
Absolutely, Dr. Elsie, it was amongst one of the most wonderful 100 minutes that we have spent in a long time. I hand over to Professor Shefali for concluding remarks, please.
Thank you, Dr. Elsie. It was amazing and it was very important. I feel it is very important for us to inculcate this humanistic aspect towards parents and their families. And, it is everybody can make a different change. Customary, you have to give one take-home message. So you want to begin, or the experts want to begin? Because I think you can be in the end. Everybody has to give one line because you have the most experience. Because if you say something, then they may not have something different to say. So I think we can have Dr. Biju, Dr. Hassan, Dr. Jitangi, Dr. Tipu just say one take-home message, and then you give the final message. Yeah. Dr. Biju. Take-home message, it's customary. Where are you?
Dr. Biju, you're muted.
Yeah, I mean, we have touched on most aspects. I think essentially, empathy, understand, and respect the child and the family, and then everything will fall in place. If you start respecting each other, respect the child, respect family, understand them, show empathy, that is humanism, isn't it? So
yeah, and everybody has equal dignity. I mean, they should understand. So many doctors I've seen, they feel they are megalomaniacs. They feel that they have the godly thing. I've seen so many residents have come and gone.
That's very true, because there's always a danger that we end up being very patronizing, and that's a problem. That's probably because, as I also said, we are all very, you should have a basic intelligence to come into med school, and sometimes along the way you pick up loads of bad habits, and that's probably why we end up being very, very patronizing. And that question which asked about stigma, there is stigma among physicians, and we all have our own biases and assumptions. And I think along with all this advocacy and everything, we should also create an environment which will encourage an open dialogue and self-reflection among these physicians. And then we will start questioning our own biases and assumptions. And then we will all be better people.
Jitangi?
Yeah, actually, I think what I felt, or my take-home message would be probably more for myself. I felt that there is in every opportunity we encounter with a patient, there is scope for us to reflect on our own humanism. Be it in the 5 Ts, or be it in the way how we speak, be it in the way how we break bad news, to bring in this, the topic humanism, and to look at, was I humane, and was there something more humanistic that I can do? So there were lots of things that we discussed. So for me, I think the take-home message for myself was, when the patient gets up to leave, I think I should reflect on which part. Not only, I only would be thinking, I'll be happy that I made the diagnosis, or I, gave him the good medication, I planned my investigations well, but I don't think I have spent time to think humanism as a KPI. So I felt that is something as important.
Thank you. It's very important. Dr. Hassan.
Thank you, Shefali. My taking home message is that humanism practice is a continuum education, lifelong. Each physician has own reason to study humanistic practice in the during the practice time. So still continue to do humanistic practice, and then in my side also I have 3 elements for humanistic rules. First one is respect to patients, and empathy to patient's situation, and then more dialogue. Thank you, Dr. Shefali.
Thank you. I think that's very, very important, Dr. Tifo.
I think though after Elsie's talk and the final concluding remarks of Bijus and Jithangi, there is nothing left. However, still I would like to conclude and say one should be optimistic all the times, and same should be for the parents and for the caregivers of these children and children's parents and the families of neurological disorders. And we should always encourage, because even in our religion, in our society, there is a social stigma to care, to look after these sort of children. So I used to give them hope, whether they are looking after children with the Duchenne muscular dystrophy or maybe some sort of degenerative brain disorders, and strongly give them a hope to look after these children, whatever the clinical condition they have, whatever the life expectancy they have, still they are human beings. So even if they are not in a reasonable good health, even if they are not able to move independently, able to go to school, but still they are living human beings, and there is always a reward behind a challenge. So optimism and of course empathy is my take-home message. Thank you,
Dr. Tifo. Dr. Vishal, your message.
I already covered, ma'am, that I think for me the message is, how can we help beyond the boundaries of economics, religion, and everything. So for every patient, this is a question that all of us should ask. Beyond the medicine part, how can we help them?
Thank you. And Mahesh, before we move to Dr. Elsie's final message.
Very wonderful talk with Dr. Elsie. He also agrees all the experts. We need to give hope to the patients. Patients come to us with a lot of hopes. So when they leave our consultation chamber, they should go with some optimism. What best can be done should be told to them. They should be going with a smiling face. Appreciate their efforts and try what best can be done.
Thank you. Dr. Elsie.
So for me, I wanna, before I tell you my home message, my take-home message, I would like to thank you, all of you, for the invitation. I have had a really great time sharing and having this conversation with all of you. I know that this is part of the solution, and so I'm optimistic like everybody else on the panel, of course. I would like to go back to just one single sentence that I said through the lecture, and it was that I really want you to make an effort in trying to treat the patients the way they want to be treated. And I think if we do that, and if you put all your talents on that, I'm sure that you'll reach a different level of practice. That will make your patient and yourselves very happy. This is not the take-home message, but this is me. There are moments in which I finish a medical visit, a medical interview. I don't know if you're familiar with if you like opera, and then there is the director that at the end, it's like all this music go on and on and on and on, and it's over, right? And there are moments in which I have been able to accomplish this, that I feel like that. I feel like the director who something that was difficult at the beginning ends up on a really good note. And that requires time and art, but also humility to learn constantly, not only about the facts, but also about how to apply the facts in a different individual. So thank you so much again for giving me this
Thank you.
opportunity. I hope that one day you guys do a new edition of Namaste. Keep it updated and keep the conversation going.
Yeah, thank you. Thank you so much. And I think if we can, besides the medicine, we can help the family understand their situation and, give them some solution and hope. That would be very important. And thank you so much, Dr. Elsie. And we would be making one document from AOCN, which would go as a paper also. And we would love to be involved in the revised edition of Namaste but we'll also be making the document, which we'll be sending to the ministry, so that we'd like your contributions and see. Thank you so much. And now we come back 2 weeks from now. Topic is parasomnias by Dr. Sanjeev Kothari from New York. Thank you so much. Thank you so much for joining.
Thank you
Bye.
all and have a great night.
Thank you.
Take care. Bye-bye now.
Thank you. Thank you. Have a great day. Have a great day. Great day. Great. Thank you.